Hi, my name is Joe Carrello, and thank you for listening to my short presentation on my current PhD project involving health economic modelling of overweight and obesity from adolescence into adulthood. I'm undertaking this PhD at the University of Sydney with support from the Australian Prevention Partnership Centre and under supervision from Associate Professor Alison Hayes, Dr. Tom Lung, and Professor Louise Bauer. Adolescent obesity is a major public health issue, particularly in developed countries such as Australia, where 1 in 4 teenagers are overweight or obese. Particularly concerning is recent survey data, which has identified that overweight and obesity in 18 to 24-year-olds has risen from 39 to 46% between 2014 and 2017, the greatest increase in any age group. There is good evidence that rapid weight gain during adolescence tracks to obesity in adults, with associated increased risk of cardiovascular disease, diabetes, musculoskeletal disorders, and certain types of cancers. A challenge in evaluating interventions in adolescence is knowing how this will affect overweight and obesity progression in the longer term. Modelling approaches can be valuable here in evaluating the cost effectiveness of interventions over a longer term and more policy relevant timeframe. For this model, I will use representative individual level data from Australian adolescents in the longitudinal study of Australian children, including age, sex, BMI, and socioeconomic position. The model will use this data to predict the prevalence and progression of overweight and obesity for these adolescents across their life course. Direct or healthcare and indirect or productivity costs, as well as health outcomes measured in quality adjusted life years, related to this BMI progression will be calculated. I will review the literature for evidence of effectiveness of interventions in adolescence and welcome any recommendations for current studies in this field. These intervention effects will be put into the model, identifying their influence on BMI progression, costs, and health outcomes over the teen's life course. Incremental cost effectiveness ratios, or ICEs, will be calculated for the different interventions, comparing the costs and outcomes of competing treatment options. The results of the cost effectiveness analysis conducted will be used to predict which interventions or combination of interventions will deliver best value for money from a societal perspective. This will assist policymakers to identify when it is best to intervene in adolescence and what are the most cost-effective solutions.